Keynote by Professor Adachi from Queen Mary University of London.
Thank you very much for the introduction, and thank you very much for the opportunity to give a talk here. And also the challenge, I have to say. I've done keynotes before, but not in 10 minutes, so let's see how we go. Just in setting the scene, where I'm coming from, I'm a social scientist and educational researcher and leader, not a medic. And then I've worked in different countries, but always in the university sector. And so I've been working more with EdTech, but more recently with MedTech because of the context that I work within now, within the Faculty of Medicine and Dentistry. And I've been basically tasked to transform digital education and online programs for the faculty. And now I head up this team, Digital Education Studio, that is an interdisciplinary team of learning designers, academics, creatives in designing and creating online programs for the faculty. And so I'm relatively new to the UK sector. I've moved from Australia last year to do this work. So just to say something about our university, we're known for inclusivity and diversity. And it's a rare thing, I think, for a Russell Group university to be like this, with 33,000 students and about 5,000 staff, and they're all coming from 170 nationalities, which is really exciting to bring this kind of interdisciplinary but also culturally diverse community. And we're known for social mobility, and it's in top 10 for medicine and dentistry. And just to mention that we also have medical school running on beautiful island of Gozo, and this is the second year of graduates going into the work of medicine. And so if you want to know more about what we do on Malta, there's a booth there, and then there's some beautiful staff from Malta campus are able to talk to you about what we do there. So we are celebrating 900 years of history this year, and since its foundation of 1123 of the St. Bart's Hospital. And even though the Medical College was officially founded in 1785. You can imagine that the medicine was conducted, and in terms of do one, teach one, see one, sort of pedagogy has been always at the foundation of what we did. And so we've seen a long history of how medicine was taught. But if you look at the context now, it's so changed in terms of medtech going into the work of medicine. And so there are about 500,000 technologies already existing just in Europe, and 34,000 medtech companies like yourself. And this is the second largest market after US of 150 billion euro market that we hold. And so thinking about what our future doctors need to be able to do, this is completely different from 900 years ago of how medicine was done. Then it begs the question, doesn't it, of what does the next generation of human doctors and health professionals need to be able to do in the age of artificial intelligence, changing the kind of work that we do. So in the remaining time of a short period that I have, I want to leave you with 3 provocations. These are the 3 issues that I think worth thinking about, really relevant to the context of the medicine and medtech. And I would love you to think about those issues in the context of the work that you do. I'm not saying we have all the answers. There are more questions to be asked, and these are the areas that I think it's important. The first one is around innovation and how we might design for innovation and interdisciplinary work to happen. And it was interesting listening to Conrad, previous speaker. NHS is completely overwhelmed system. And so how might we bring those different types of people together to do innovation work is really critical. And there are lots of innovation frameworks in the literature, and this is just one of them, the triple helix model, where I've been kind of working with government, bringing the funding, universities as a knowledge creation institution, and the industry partners that can do agile, prototyping, failing fast, taking risks sort of work. And so this area of innovation with interdisciplinary team is really important. These are a couple of examples of the projects in flight with Queen Mary at the moment. first one on the left is a digital health MOOC course, or open online course, in partnership with a university in Egypt, Ain Shams University, and their virtual hospital, and it's funded by British Council. And so we're bringing the government to fund the work that we need to do, but really educating people about the digital health work. And it's been really eye-opening exercise in thinking about how digital health is done in Egypt and in the region's countries, and also here in the UK. On the right, you see the new MSc program that we are developing in robotic surgery, led by Professor Rajan in our faculty. He is a senior consultant in robotic surgery and urology. And it's also with Medtronic. I think they're here at this conference too. It's one of the biggest medtech companies in the UK in robotic surgery. And this is also bringing another faculty of science and engineering. And so we're working with engineers to think about how this could be done in partnership with industry and another faculty to teach students about how the next future generation of surgeons and doctors need to be able to work with this kind of medtech. So in this context, language, culture, and context really matters, particularly language. When you think about academic coming in with really understanding the clinical language, but not have any ideas about how coding is done, that machine learning works, you almost need like a translator to be able to cross-fertilize this kind of knowledge and ways of working. And so culture and context in which you design innovation really matters. The second one is around AI, and I'm sure you've been talking about this to death. But if you think about ethical and authentic use of AI, there's no doubt that our students are using AI. And these two papers that I draw here are from the US. The ChatGPT is already passing medical licensing exams in the US at about 60% accuracy. And we are not really teaching students how they might use ChatGPT or generative AI in the way that they study, but also in the work that they will be doing in clinical placements and in how medicine is conducted with things like AI. We're really behind in educating students around those kind of practice. And so not only thinking about the authentic practice of AI and technologies moving into the medicine and work around the medicine, we really need to design curriculum, assessment and feedback so that we develop these digital AI data literacy into students so that they are equipped for the world of work into the future of medicine. Building on that, it really asks the question of what is the role of human doctors then, if we assume and we know that the AI and machines are doing the work of medicine already. Now, if you look at the General Medical Council's learning outcomes, it's really comprehensive. This is essentially what we're teaching students to achieve by the time that they graduate from this medical school. And it's ranging from professional values to professional skills and knowledge that are clinically oriented, but also 21st century human-centered skills like empathy and compassion. But they don't really talk about what the digital doctors might do or human doctors do. And then things around communication skills in electronic methods. We know that it's not just about emails and things that the doctors do with electronic methods. We need to broadly think about, for example, telehealth, where doctors are engaging and supporting patients online. What kind of skills are needed? And these are the kind of human dimensions and human skills that we talk about. This is a work by Dr. Yuni, who is one of our medical educators in MBBS, and she's been talking about this conceptual framing of flourishing, and she does this with creative arts curriculum in MBBS, where arts and creating art becomes a vehicle to talk about vulnerable self and how we might work with things like empathy and compassion in the way that doctors do work online with patients. And it's a really rich literature that she draws on. So human experience really matters in terms of thinking about design and development of the MedTech also. So this idea of UX and usability on the paper on the left, they have looked at 88 papers in the literature that then talked about this idea of UX and usability for designing the MedTech. But essentially their claim is that we don't do this really well, and the standards in which they apply UX design is really varied. And this is something that we need to think about, and looping back to the idea that I discussed around innovation and interdisciplinary work to happen, we need to bring in patients and the users of the MedTech. Otherwise, it really doesn't work well. Because if you think about MedTech, it's all about the use, isn't it? If people don't use MedTech, it really does not provide any service for the patients. And so we want to make sure that the front-end experience is sound, easy to use, and therefore MedTech is used appropriately with the patients and doctors and the like. So we need to bring those people into the design and development as a process from the start. So very quickly, I'm wrapping up, and right on time, I think, the three key provocations that I'm leaving you with, which is around the idea of innovation and interdisciplinary work. How do we bring different types of people together, and ethical and authentic use of generative AI, even though that we can't really stop this movement. How do we educate our future doctors around this idea? And looking at the human doctors and what we can do against the machines and AI, the human dimensions really matters in the way that we educate our students to be equipped for the future world of work in medicine. Thank you very much. And you have my contact there, and I'll be very happy to speak to anyone who might be interested in furthering this conversation. And I'm sure you can get the copy of the slide as well. Thank you.